the disease first struck are saying this morning that face masks may have played a role in helping them contain the coronavirus outbreak. And not hospital grade masks, just masks made of fabric. The head of the Chinese Center for Disease Control and Prevention told Science magazine that the big mistake in the US and Europe, in my opinion, is that people aren't wearing masks. Many people have asymptomatic or pre-symptomatic infections. If they are wearing face masks, it can prevent droplets that carry the virus from escaping and infecting others. Jeremy Howard, a research scientist at the University of San Francisco, wrote an op-ed in the Washington Post highlighting data from COVID-19 success stories in Asian countries such as South Korea, Hong Kong, and Taiwan, where everyone is wearing masks.
So I've analyzed 38 scientific papers that have looked at the relationship between using masks and the transmission of COVID-19 and similar kinds of viruses. And they all tell the same story, which is that wearing a mask can decrease transmission by up to 50%.
Here in the U.S. in late February, the U.S. Surgeon General shared this on Twitter, saying, seriously, people, stop buying masks. They are not effective in preventing general public from catching coronavirus. The government's advice is in stark contrast to what people are practicing in countries such as Japan and South Korea. Again, these are not N95 masks that health workers desperately need. Some health experts believe one reason U.S. officials have discouraged people from buying masks is because the N95s are in short supply.
But there is some rationale that the person in the street who may not know they're infected could actually prevent the spread to other people by wearing masks. This hasn't been proven. We know the masks are not 100% effective. People might think and get under the impression that if they wear a mask, they're completely protected, and they're not.
And what we know about this virus is that it most likely spreads via respiratory droplets that are large droplets, and that can be aerosolized. That doesn't necessarily mean airborne yet. 3 to 6 feet or more. So obviously when you're breathing, singing, and not just coughing or sneezing, that's where those droplets can spread. And that's why the social distancing is so important. But again, in science and medicine, we continue to learn more and more every day. And this virus isn't even 4 months old yet.